The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. It's Dr. Lederman with the Radiosurgery Hour. We're here once again to talk about many different things: how to improve your life, how to live longer, how to understand what doctors are doing and thinking, how to learn from cases, speak to experts, and take your calls. So every week we have new shows. This is on WOR, and we're live in the studio at WOR. This show is devoted to you and educating you and your loved ones about hopefully having a better life and a better quality of life. My name is Dr. Gil Lederman. I'm a triple board certified medical oncologist, radiation oncologist, internist, practicing radiation oncology in the heart of New York City at 38th and Broadway in a modern, new, spacious radiation cancer treatment center. The beauty is it's a private cancer treatment center, which means we work for you, not the drug companies, not the surgeons. We work for you. We take most insurances, Medicare, Medicaid. So it's easy to make an appointment. We don't have machines. We have human beings to answer the phone and to work with you. We don't have students or residents. We have real doctors who will be your doctors and take your call day or night, whatever you need, 24/7, which is very different than most centers. So tune in. We're going to spend the next hour talking about interesting cases and many new cases, some that I just heard about in the last few minutes. So if you have questions, please call us at 1-800-321-0710, 1-800-321-0710. Noah and Ed are manning the fort. They are running the show. They are running this studio, and they do a fantastic job. I want to talk, first of all, about a friend of mine, a friend from 1973. When I was a student in Iowa, he was a student in New York. We met in Israel on a summer tour, and just this night he called me about his daughter-in-law, his new daughter-in-law's best friend, who has a difficult situation, and I want to tell you a little bit about her and the conversation that I just had just a few minutes ago. The best friend is a 33-year-old woman. She's married. She has 2 babies. She was diagnosed, if you can believe it, 33 with an unresectable colon cancer. The colon is a part of the bowel that goes from the small intestine to the rectum. She was said to have a stage 3 cancer, which means it involved the colon and lymph nodes. She went to a big cancer center, and they felt that she was unresectable. They gave her lots of chemo. The chemo didn't work, and in fact, the cancer spread. She had more chemo, and the cancer went into the liver and to the abdominal cavity. So it went from a stage 3 to a stage 4, and at 33, with 2 little kids and a husband, they're pretty much telling her there's no effective treatment and are offering clinical trials. Now, what does clinical trials mean? Well, very commonly it means that it's treatment that hasn't been used in human beings or hasn't been proven in human beings before. It's often sponsored by the drug companies to promote or to investigate new agents. Obviously, they have a lot of interest to have human beings with cancer, especially young ones like this woman. So most likely she has no other comorbid disease, so she's an excellent candidate for them. The question is really, is their clinical trial good for her? And from the patient's point of view, that's how we like to look at things at Radiosurgery New York. We like to look at things, what's good for the patient. I don't particularly care about what's good for the drug companies. The drug companies will take care of themselves. But what's good for the patient? Should a 33-year-old woman go on a clinical trial with really no data, nothing to guide her? Her friend said, well, then we can go to XYZ hospital. We can go, and she named some famous places, and see what they have to say. Now, I listened to her. I asked questions. And most likely someone like her, 33 years old, and whether she's 33 or 53 or 83, really the issues are the same, and the issues are how can she try to get better, how can she get into remission, and what's best for the patient. That's who we care about, the patient. And I offered and suggested, first of all, that I see her and review all the documents, which is the best way to analyze any patient. Spend an hour, 2 hours, whatever it takes. But in general, clinical trials, while great for the facility and the hospital and the drug company, may not be so fantastic for the patient. Some people would put a patient like this on hospice, which means there's no real good care. The cancer's progressing. She's gone to a big cancer center, and nothing they've been able to do is really stop the cancer. In fact, it's progressed on the treatment. We talked about other approaches. We talked about radiosurgery, which is a method of us attacking cancers where we see bulky sites, like in the primary site, which has been unresectable and really untreated, or the 5 sites in the liver, or possibly in the abdomen. Now, with radiosurgery and our data, and we continue to follow our patients, we've treated about 20,000 patients, and we follow our patients. We were the first in America to perform stereotactic body radiosurgery, so we have the longest track record and quite a vast track record. Most probably we can stop the cancer where we attack. Now, about the cancer that's in her body that's popping from one site to the other, we talked about other methods of treatment, innovative methods where perhaps a small amount of cancer cells are taken, grown in a laboratory, and so this woman, this 33-year-old woman, has her own cancer cells analyzed and tested with maybe 30 or 50 different kinds of chemotherapy and at different doses to see if you can make a custom-made recipe for this woman to find cancer treatment that's customized for her. So rather than doing things that are great for the drug companies or the big hospitals, let's do things that are great for the patient. And we hope to increase the patient's odds and the chances. I told her about this. Obviously, she should digest this, listen to this, think about it, and whatever she decides, I always believe that the patient is the president of the United States of their body. The patient should decide. The doctors are advisors, and we all have our own perspective. I luckily am triple board certified in medicine, medical oncology, and radiation, so I have a pretty broad perspective with lots of training 9 years after medical school. I want to talk about another patient that I just saw Friday night, just before I ended work. A patient and her sister came in. She's 50 years old. She had breast cancer treated in 2001, lumpectomy and radiation. She had good results. And this summer developed a mass in the lung and biopsy-positive cancer. In fact, it's been percolating for several years. She's had chemo, much like the last patient I talked about. Lots of chemo and no response. Then she went for radiation elsewhere. And the doctor told her, well, she had radiation before, so he can't really do radiation, so he'll try to go a low dose of radiation and try to go slowly so not to hurt her, and he'll do larger fields. Well, this is exactly the opposite of what we would propose. We propose focused beam treatment to hit the cancer, not the healthy lung. Treating the healthy lung doesn't help her doesn't help anybody. Number 2, by giving low-dose radiation in small fractions over a long period of time is great for that doctor because he gets paid by the dose, but it's not great for the cancer. There's something called the dose-response curve, and the dose-response curve means that the higher dose you give per treatment, you can give fewer treatments that are more focused, the more likely you'll have success. So for lung cancer with standard doses, the success rate's only about 50%. With us, where we aim the beam, the success, which means to stop or shrink or make that cancer go away, is about 90%. And that's not for 3 weeks or 6 weeks or 3 months. Those are data for the rest of the patient's life. So, of course, the patient left confused. She was told, you have a little dose, slowly, not to hurt you, or by me, you should focus the treatment on the cancer, give intense treatment that has a good track record of stopping or shrinking the cancer. So she's been told diametrically opposite things, and now I told her, think about it. She doesn't have to decide this moment. She can think about it. And many of our patients that we see have had prior chemotherapy or radiation or surgery that didn't work. In fact, we probably have the largest experience of giving patients radiosurgery after standard chemo, radiation, or surgery didn't work. So we have 2 cases, 2 women, both in the prime of their life, both in trouble, both having treatment that really didn't help them very much. The beautiful thing about practicing radiosurgery is that most of the time we succeed what we set out to do, which is to stop, shrink, or make the cancer where we attack disappear. Some people say, isn't it sad? Isn't it a difficult life? Well, actually, no, because most of our success rates are seen every day in our patients, and we can face our patients and show them the results and show them independent radiologists reviewing the cases with good results, shrinking the cancer, and most likely avoiding side effects. Of course, each case is unique, and each case is different, and each case is a human being with a family and loved ones and friends, and we try to address all those issues. We do have booklets and DVDs, so we have 3 separate booklets, one about brain tumors, one about prostate cancers, and one about cancers of the body. And we're happy to send one of those to you at no charge, along with a DVD. And we have a new DVD that just came out, which was produced, called Making of the Show, Behind the Scenes with Dr. Lederman, and talks about how we make the shows, answer your questions, and what we do every week to prepare for this show. So, if you have questions, again, please call us at 1-800-321-0710. Noah and Ed are in the controls. They're happy to take your calls. And we're going to talk a little bit about new cases and more data in just a minute. Now we're going to hear from some voices about our work.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York. First for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. to hit the cancer. Call Dr.